So the second topic we had was a little bit of a potpourri of like the really commonly asked questions that we get as vets in exam rooms. So we're not going to dive deep on all of these topics. We're just going to kind of hit upon them the way we would if we were asked by a client. Some of them are things that we've gone over before here, but they're just still really
still fun,
always common. So, do you want me to start asking me a question?
Yeah, why don't you can start asking me one.
All right. How often should I have my dog's anal glands expressed? We're going to start with the butt.
Oh, all right.
Yes.
So anal glands, for those of you that don't know what they are, they're two small glands that live right inside the rectum of dogs and cats at about like, I don't know, 4 o'clock and
8 o'clock. Yeah.
Right there. If your dog's butt was a clock. So these glands get filled with this sort of awful smelling material.
It's their scent glands.
Yeah, that should normally express when they go to the bathroom. So when they defecate, those glands will express. And so some people have heard about it either because their own dog or cat has had issues with it before, or because they hear about it from the groomer, or they hear about it from some friend that says, oh, you got to check your dog's anal glands. So what I tell people, if they come to me and they're saying, what do I need to do about my dog's anal glands? And the dog has never had anal gland issues before. The dog has never, in the medical record, ever been excessively scooting, licking, any medical issues because of that. I say you really don't need to do anything.
You can just forget them.
You just forget about it. It's for the patients that are having issues. And they can have issues for a variety of different reasons. But for a regular dog or a regular cat, for the love, for a regular cat, don't be expressing your cat's anal glands on a regular basis if you don't need to. If they're not having any medical issues, just leave it alone.
Just leave them alone.
Just leave them alone.
Yeah. There's more important things for you to do than express your dog's anal glands.
Don't worry about them. Don't worry about them.
For sure.
Yeah.
All right.
That's a good question.
How often do they need their nails trimmed?
Well, that's a good question too as well. So cats and dogs are going to be different. Again, what I tell people is for puppies at least, I start off with the first puppy visit to try to get people really used to touching their dog's paws and getting them used to it. Because if they resent it or they hate it, as they get older, it's going to be absolutely miserable for you at home to be doing it on a regular basis. And unless those nails are curling around or causing some significant problems, I tell people if they hate it and you trying to trim them at home and you can't do it and they're not excessively long, just leave them be.
Yeah.
Leave them be.
The trouble is that the amount of time you have to go is like, well, how often do you have to cut your nails? You have to cut them when they're long, right? So for every animal, that's going to be a different amount of time. For some cats, they keep their nails nice and pointy on the scratcher. You never hear them clicking around. They don't need them done. For dogs, the same thing. If they walk on a lot of pavement, they're just wearing them down themselves. My dog never needs her nails trimmed, although she does get it done at the groomer. So I assume
so maybe she's trimming some of it. Yeah.
But often there are many animals that you just don't need to trim their nails at all.
Right, unless it's going to be an issue. And some of the cats, and it's nice if you can get used to your pets having them done, even if they don't necessarily need it, because I'm telling you, it's more of the struggle, I feel like a larger dog that hates its nails getting trimmed.
Or a pug.
Oh, you're trying to trim those dogs' nails. It's going to cause you and that dog so much stress. Right. Same thing with a cat. If you can get used to sort of fiddling with your cat's nails, because as they get older, they might not have needed it their whole life, but as they get older, they don't necessarily do the things that they used to do to kind of trim them down. And then they end up having these sort of ingrown nails, and then that becomes more of an issue or problem.
And that kind of brings you to, well, how do you know when they need them done is that you've been looking. Right?
Yeah.
So if you never exteriorize your cat's nails and see where they are, you're not going to know. And then you are going to have that, situation where they're wrapping around or you hear your cat's claws clicking on the floor. And you're like, what is that?
Right.
So you should get kind of accustomed to checking all the different parts of your animal.
Yeah.
Maybe not every day, but every week or as you're petting them, squeeze their little paws to squeeze out their claws and take a look and all of that. They'll appreciate it as long as they're not jerks.
Well, that goes on to the next question that I can then ask you. So how often should you clean out your dog's ears or your cat's ears?
So it's actually similar to the anal gland thing, where an animal that is not having any ear problems and never has, you don't clean them out. So floppy-eared, pointy-eared cats, dogs. Cats actually groom themselves pretty well. A problem is when they stink bad, or when you see a lot of debris, or when you have a dog that swims a lot, or a cat that swims a lot.
Not likely.
Not likely. Or an animal that's had frequent ear infections. So then we're going to perhaps embark upon a routine cleaning regimen. But the average dog or cat doesn't need them. And in fact, if you start throwing stuff in there and messing with them, swabbing them, you actually cause more problems sometimes.
Yeah. Yeah, leave it be.
Is that your answer too?
Oh, yeah, that's my same answer.
Good.
Yeah.
Good.
Yeah, we have some questions over here too. One of them is, are blood tests necessary for healthy pets?
Oh, that's a good. We actually didn't write that down on our list of things.
But that's a good
I like
one.
that one.
Do you want to answer? Do you want me to answer?
I can answer.
Go ahead.
We both probably have the same answer. So my recommendation is, I love doing blood tests on healthy pets. I love getting a baseline of your pet and seeing exactly where your pet's values are. And the reason being is, let's say you have a cat. Cats are sort of notorious for getting kidney disease as they get older, or renal disease as they get older. And so by seeing sort of where their kidney values are, as time goes on, we can see, are they slowly trending upward? Where are those values going for your particular cat? I love getting baselines. I do.
Yeah, it's the kind of thing that I don't judge you if you don't want to do it. You know, a lot of owners of young, healthy animals just say, no, that's okay, they're fine. And you know what? The blood work should be normal. We're expecting it to be normal.
Right.
But what I do in my dog is I do blood work every time she comes in. If she comes in just annually, I do blood work. If she's sick with anything, I do blood work. So that kind of speaks to what I think for my own pet. I know now exactly what her liver values are, her kidney values are, all of that. And you can actually make adjustments to things, even if they're all within the normal range, but you notice one thing has doubled, the kidney values have doubled or something. And so it's much better than a snapshot. It's really a trend throughout their entire lives.
And
most people don't. Probably 20%
and that's
of
okay.
people
Like you
do.
said, it's okay.
Yeah.
And even with like some of the pre-surgical screening that we do it on like healthy patients. We're looking for things that might be flags or indicators to say, hey, wait a second. Even though this pet looks clinically normal right now, I am seeing a change in the liver values that I don't really like. And could this mean that something else is going on, or do they have an underlying condition that we really should know about earlier and address sooner than later? So I do love doing that.
It's also tough when you have a 12-year-old animal and they've never done any blood work, which again, no criticism at all. But then now at 12, well, this thing is elevated. It's only elevated by 2 points. Well, has it always been? Maybe it's always been.
Yeah.
Maybe since the animal's been a puppy.
Right.
And so it's not anything to worry about. Or maybe it's the early indicator of something, and now I have to do more blood work or I have to do more things. So, yeah, I love it.
That's a great question.
Any other questions?
Yeah.
Which is a lot.
We have a lot over here, yeah. Is it beneficial to have pet insurance? And are vets getting anything from people signing up for insurance?
Oh, that's a great question. I wish.
Yes,
No.
it's beneficial to have
kidding.
pet insurance. So pet insurance, generally speaking, is the kind of thing where you're paying a reasonable monthly fee. Depends on the insurance, what that fee is, what breed, what age, all of that. So I can't quote you like how much it is. It's very variable. But that monthly fee then goes towards when you have a health episode with your pet, they pay a portion of it or maybe pay most of it for you. I find most health insurance, there are a few health insurances that I've been a little like, I didn't feel like they got what they should have for that. But most of the time, they provide a very good way of you being able to do whatever you think you want to do for your pet without worrying about the money. Every pet insurance client that I see, when I say, I want to do some blood work and x-rays, there's not a single like, let's just do the blood work or, worrying about it. They say, I have pet insurance, so go ahead with whatever you need to do, which is liberating.
It is liberating.
So no, we receive not a single kickback,
Nope.
anything from pet insurance. What we do get is to be able to provide the care that we want to be able to provide to the pets without worrying as much about money.
Yes, 100%. And it's one of those things where it is insurance, right? So if you have it and you've been paying for it and you never need to use it, you're like, oh man. But at the same time, if you have it, I mean, we do that first off. If you have it and you have a pet that's sick, it is so nice to have. I mean, it really is this godsend. So I love pet insurance.
Yeah, I have pet insurance on my dog. I have never once submitted a claim. I will keep it forever.
Yep.
I do not feel that it's money not well spent at all, because if I did need to have, my dog have back surgery or whatever it is, I just don't have to worry about it.
Yeah. So, and I think that it's going to become more and more common as time goes on. I mean, it already is more common than it was, let's say, 10 years ago. So I do think that it's going to be, and I do like hearing that some employers are offering it through their their benefits, like through humans, employers are offering it through their benefits. So that's really nice. It's a huge trend that I hope continues.
I have insurance, and I used it for my dog's surgery.
Yep.
And after the deductible, I got 90% back.
Like, that's crazy.
Yeah.
That's a great,
So that was good. How would you recommend picking a family veterinarian?
This is my topic.
This
that
is
I wanted
great.
To, yeah.
These are great questions today.
Interesting. Do you want to start? You want me to start?
Why don't you start? You got so excited.
Oh, I got excited because I had given this a lot of thought, because I have had a few clients recently that moved to different parts of the country, and they said, "Oh, do you know anybody there?" I'm like, "No, I don't know any vets in Florida. I never lived there. I don't, whatever." So the biggest things I think are making a list for yourself of the things that you think are valuable. So every vet hospital is going to have a slightly different culture and way that they practice, and that's going to be a lot of the time dictated by the owners of the practice or the vets that work there. So you need to decide what's important to you. So for some people, the vet always knowing their name and their pet and being extremely personal and seeing only that one vet always is going to be the most important thing. For some people, it's going to be, well, that I don't care about as much, but I need to be able to go at 8:30 p.m. on a Friday.
Right.
Right.
Yeah.
I need to have wider hours, or I really want to go to a place that has emergency and specialty care, so I never have to go anywhere else. I just go right there. So that's a thing to think about first.
And that's first question for sure, is to dissect that out. Yeah.
So then when you've decided that, now you say, I want a small practice. So now I would start with a Google search with your address. You generally want to pick a place that's in a reasonable proximity to your house so that you're not going to feel like it's a massive imposition to go to the vet every time, right? You don't want to drive an hour unless you absolutely have to. So we have clients that drive an hour because they used to live somewhere else and they just love us, and that's great. Generally, you want to pick within your radius, right?
Right.
And then what would you do after that?
Well, then after you sort of narrow down the search to like maybe a few practices, then I would look at, I know it's awful to look at reviews, but I personally do have some sort of a review search. I just kind of give myself a little bit of an indication.
I would look at Facebook more than any other review site.
Yeah.
So people are more honest on Facebook because it's attached to a real person.
That is
Whereas
true.
Yelp and Google, you can set up an anonymous name. People can have a vendetta, or, it potentially could be, the owners of the practice. So for the other end, for 5 stars. But with Facebook, it's attached to a profile, a real person, and they're more likely to be honest.
Well,
so
you can
whether
set
it's
fake
you
Facebook
can, but
profiles, but people don't.
I would say from us who manage the social media, it's usually real people, and whether it's 1 star or 5 star, they're more.
Yeah.
And I do think that like when you do look at reviews, and I always say this with a massive a massive yellow flag of caution or red flag of caution, is that I don't take just one review and go, that's it. I'm making my opinion on it, because you're right. You can get people that start writing reviews for a variety of different reasons. You can get people that, like you said, may have vendettas, or they're upset about something, or they have a good reason to be positive. So I do look at it sort of as a part of my search, but it's not all out of, I don't put all my eggs in that basket.
The thing with reviews is, when you think about it, think about like Amazon reviews for a product, right? I always look at the reviews.
Yes.
But I look at the 5-star reviews, I look at the 1-star reviews, and I will say that for even the dumbest products, like it's like a spoon, you'll have a couple of 1-star reviews with no reason.
Yeah.
And then you'll have 1-star reviews that are just ridiculous. Like, the product was not packaged properly. Well, I don't care about the packaging. What I care about is the spoon. Right? So these are things that when you read reviews of businesses, you have to think about too, that these are not necessarily people reviewing it that have any medical knowledge or anything. They might have had a good experience for what you might think of as silly reasons. They might have had a bad experience for what you might think of as silly reasons. So you do have to look at it with a grain of salt and say, are these things that I think are important enough that it would keep me away or keep me going to this place?
I think trends too.
Yeah, trends are
so
huge.
like
trends. Right.
We can use a restaurant for example. If everyone's saying that the food's coming out cold, I mean that's kind of a trend. Even
Recently,
the 5 stars,
right.
the food's coming out a little bit cold, then there's a trend there.
Right. And then another thing that, again, this is, you have to take it with a grain of salt, but I mean, we have, the town that I live in has a really good town website, like it's a Facebook community as well, and you can post on there, like, has anybody had an experience with this? What do you think? And so you're actually soliciting from people that, a lot of the people that you do know. I know you, and as I say, it's a grain of salt, but I definitely think that for some reasons, like when you look at it, they actually do, you know, there are a lot of people that are very willing to give opinions, and you do have to dissect it out, but it is kind of nice.
The reason why I hate those, Lindsay, is that, like, I've quietly sat on mine, right?
Yes.
And someone will say, oh, can you give me a good recommendation for a vet? And then you get pretty much everyone posting their vet. So it's all the vets in the area. Well, and then there'll be ones that I'm like, oh, I don't think you should go there. And then these people really love it. So I kind of, you know what, though, everyone has different.
But this is the hard thing, and that everybody has different feelings on what they think. And I can speak to this personally through my own pediatrician experience, which is very similar. People say, like, what kind of vet, how do I pick up my best vet? It's really hard. Well, yeah. It's really, really hard. And I switched. I went through like about 5 different pediatricians before I finally have landed in the office I'm in now. And so I don't think I have an exact science of how to find it right off the bat like that either. Sometimes you do have to go and experience it and kind of have a feeling what your gut is telling you. Is this right? Is this wrong? Does this person seem to be engaged the way that I want them to be engaged with my kid or my pet? Does this facility have all the things that I need that I find important? You know, how are the hours? You know, but I think at the end of the day, when you finally go to that appointment, even if you've checked off every box, like it's got the hours, it has the facility that I want, it's the kind of feel that I want. If you go there and you don't connect with the vet, that is something, or don't connect with the doctor, that is something that you can't necessarily find that out before you go.
You know, other things, little quick tips would be, ask your neighbors. So if you're in a neighborhood, you just moved in and you're having a little block party, pick their brains right now for where they go to get their, you know, teeth cleaned, and where they go, all of those things. Again, it's the same kind of thing, but if someone's to your face, then they can say to you, oh, I didn't like them because they charged me X for the thing. Be like, well, I don't really care about the price. I just want to go to a good place. And they're like, oh, they're wonderful otherwise. Okay.
Yeah.
The second thing is, you know, look them up online. So, you know, we're in a day and age now where hospitals have to have a website. So for me, I would never choose a vet that doesn't have a website. And that's just a thing for me that, like, okay, I'm a vet. We've put a lot of time and energy into our web presence. And if you don't feel like that you think that that's important, that's fine. But I want to be able to find some information online. So then I think about, okay, what might I, as an owner, be wanting to find out about this hospital and see if it's there. Ooh. See if it's there. You know, see, do they list their hours? Do they have pertinent information? Do they have any helpful information? Do they have a contact us button or something?
And they do have a lot of times they'll have bios of the particular doctors on that same site.
Nice little pictures. They'll have the staff on there. They'll talk a little bit about their philosophy, which generally in veterinary medicine is all very similar. But those are some tips. That was a long topic.
We can keep going.
How long do we have to in this podcast?
I mean, we've been going for a half hour, but I'd say we have a couple more good questions.
Let's do it.
I mean, I think it's just going to be a long episode.
Yeah,
stay tuned.
Good. Okay.
Okay. Do all puppies have worms when they are born?
Oh. Not all, but many.
A lot.
Yeah.
Yeah.
There's this weird thing that their bodies. Well, do you want to talk about it?
Well, no. You can go ahead.
So excited.
Yeah.
So you have an adult dog. It's like the chicken or the egg thing, which came first, right? But the mom dog was born probably with worms, right? She was treated. But a lot of the time, little worms actually live in the muscles. It's super gross. They're called encysted. They're encysted in the muscles. And they just live there with no ill effects, no problems, blah, 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 no issues. Until she gets pregnant, stressed out, and her immune system's a little lower, and then they come out. And they set up the infection in the puppies. So some worms pass via the uterine environment, some it's via the milk. But that's a thing that happens. Those encysted things, it's not like a bad breeder or anything. You can't treat those away. They're just there.
But that's why, I mean, deworming protocols and puppies, we do on every single puppy.
Every puppy.
Regardless of their stool analysis or not, because fecal analysis, when we look for worms, we're looking at, to find any eggs, and you might not necessarily find it. It's a false negative, meaning they really might have them, and you're just not necessarily seeing the actual eggs.
Or it's too early to pick them up in the feces.
True.
Yeah.
So just deworming them is so safe and benign that we deworm all puppies. So, yeah, it doesn't really matter. It doesn't matter to us. Yeah, puppies and kittens. It doesn't matter to us, but we would deworm them all.
Yeah.
All right. So, why do hospitals ask to pay the bill before anything is done?
Oh. Unfortunately, if we don't, we have had cases where we do all the surgery, all the necessary medical needs, and then at the end of the visit, the client takes the pet home and doesn't pay us at all.
Yeah, it's an unfortunate thing in our world that people don't pay their bills. And it's not all, but it is very frequent in this, especially in this field where things are moderately expensive, right? So, people say they have the money to pay it and they don't, or their credit card's maxed out or whatever. So the thing is, like, you're at a store, you're asked to pay for the goods before you take them home, right? I guess at restaurants you pay at the end of the meal, but like the whole adage of like, oh, I'll work in the kitchen. Like, you can't have services performed without paying for them. And generally speaking, we're just, with the high cost that we have to maintain these businesses, we're asking you to pay for them when the services are rendered. Just because you may pay and the next person next door may pay, but I'm going to tell you that it's almost 100% of people, if they don't pay when they come here, they never pay.
Yeah. And it's a huge process afterwards, to try to deal with that. And for the vast majority of all veterinarians, and honestly the support staff too, we hate talking or discussing money. It's not necessarily something that we want to say, like, yes, your dog needs surgery, but you need to give us X amount of money before we do this. It just is a necessary evil in some ways. But it just
and
makes
when you think about it, what is the recourse? Like, we are kind to people. I'm just going to say it. Like, we go into this field for reasons that are not financial usually. But what is our recourse if you don't pay us? So we just spent, for, let's say the surgery costs $4,000. Well, we just spent $3,800. The profit margins are very low. And now you're saying you can't pay. Well, we can't keep your pet. Like, we're not going to keep your pet hostage. You get to take your pet home, and we're just stuck with this bill. We still have to pay our staff. We still have to pay for the lights, the building, all of that stuff. So
medications
and all of those things. So we incur costs, and we want you to cover those costs then.
Yeah. Let's do this one. Do I really need to do a heartworm test every year?
Oh, that was one of our
questions. Yeah, go. You go.
So heartworm tests, we say it's a heartworm test, but I try to reword it now in my exam rooms. It's not just a heartworm test. It also tests for other tick-borne diseases. So it tests for Lyme, Anaplasma, Ehrlichia. These are things that your pets can pick up that can have negative sequela if they have them, and we don't know that they have them, and they might be becoming symptomatic, and we need to find out sooner than later. So it is a yearly blood test that we recommend on all dogs. And even if they're on preventative year-round, which probably a lot of people say that they do, but I would say there's a little tiny minority of people that actually probably do heartworm medication year-round and are consistent with it. But it's one of those things where it's good to do every single year because you're screening for really common infectious things in this area. And that way, if we know that they have it sooner than later, we're going to be addressing those problems sooner than later.
Yeah, and I recommend heartworm and fecal testing annually as a kind of a bare minimum of wellness testing, even if you don't do the blood work that we talked about before. You want to make sure your pet is parasite-free and easily detectable disease-free. So these are really common things in this area. Heartworm is not that common around here, but if your dog gets it, your dog is going to be not having any symptoms for maybe a year or two, but that is constantly causing damage. So then when we finally do detect it, if you only do your heartworm test every 2 or 3 years, There will be damage that is done that is irreparable. So the other thing that I always say, which I can almost tell whether the owner's really good about giving their heartworm prevention, because if they say, no, I don't want to do it, I'm like, well, listen, that's fine. We do recommend it because we have had dogs that were on heartworm prevention that get it now. And then I'll be, maybe those owners weren't giving it and they were telling me they were. And then, I mean, no joke, half the time the owner goes, we better do it. Because let's be honest, I miss my heartworm pill sometimes.
Right.
I cannot say I'm 100%. And I think that only about 20 studies have shown that only about 20% of owners are truly religious with their heartworm prevention.
And I think that's even generous.
Yeah. And I do believe that those 20% that are truly religious are probably at low risk for heartworm specifically. But I do it to make sure.
Yes.
I do it for the diseases that you mentioned as a surveillance thing to see what we have in our area. And just once in a while we come up with a positive.
Yeah. And I mean, that sort of also segues into another question that we had as far as like how important is heartworm prevention throughout the winter months? A lot of people think, well, heartworm, it's transmitted by mosquitoes. There's no mosquitoes that are alive in January in Boston, so do I really need to give my heartworm medication? I say yes, I like it year-round, and not just for the heartworm portion of it, but on a lot of those heartworm preventatives, they have in it medications that deworm your pet that
every month,
every single month. Yeah. So, I mean, roundworms, hookworms, whipworms, things that they can get year-round, especially if they're in doggy daycare situations or they're in dog parks.
Or they're just walking around. My dog sniffs dog poop.
Yeah.
On the street that my lovely neighbors did not pick up. But guess what? I don't know if my lovely neighbors have their dogs on heartworm prevention either.
So I like it year round, and it gets you into a good pattern of behavior.
Gosh, my neighbors.
Your poor
I'm trashing my neighbors today.
We have 2 more questions, then we're going to cut it off there.
All right.
So one is actually similar to what you were just talking about. This one is, my dog has never had fleas or a tick. Do I even need flea?
Know of.
Do I even need flea preventative?
I have to say, so I don't love, because I don't want any animal to have anything, but it is quite maybe ironic when people say to me, my pet has never had a tick.
And then you comb them down and there's the tick.
Or then they test positive for Lyme.
Yep.
Or test positive for anaplasma. And they say, I can't believe that. And it's like, because these ticks are so small sometimes that there's just no way that you'd be able to tell. So fleas, I could see if your pet doesn't have fleas. I mean, I guess if you don't live in an area and you're not around
Lindsay, every pet I have ever seen whose owners say, I don't use flea and tick, they have fleas.
It's
and
true.
the owner didn't even know.
They don't know. I mean, so I guess I could see.
Even in
Massachusetts.
Massachusetts.
What you think. I see what you think as the owner. But I'm telling you, it happens all the time. They have that stuff.
So I recommend flea and tick for every single dog.
Year round.
Because
honestly, even on warmer days like this, you can get ticks. I mean, the ticks they're not like hibernating for the winter. They do stay away in blizzard weather when it's like really, really freezing cold. But I think it's like 39 degrees is like they can come out and I start questing for a host.
And you can go to tickencounter.org, which is a nonprofit that discusses ticks in your region, and it's very, very helpful for you to understand tick life cycles.
Yes.
And fleas. They might have fleas. Keep the fleas away. Fleas are gross.
You have a ton of people freaking out now and throwing out.
I know, right? No, not every dog. But I mean, it really is true that very frequently when you have those outdoor cats that the owners don't do stuff, or even a dog. Like I had one dog one time that kept coming in for itching, and every time I saw the dog had fleas. I'm like, so are you doing the flea and tick? No. Well, you could save this vet visit.
Yeah.
The cost of the flea and tick pill that you give once every 3 months is cheaper than the office visit that you pay every 2 months when you come in for itching. You know? So, yeah.
The last question is one that we see for all hospitals, I think, on social media all the time is, why are the waits always so long in emergency?
Ooh, that's a great one.
When it seems to be fairly slow.
Oh. Okay, perception.
Well,
yeah. So, well, first off, let me let's sort of say about emergency rooms and wait times in general. We'll kind of like...
We've both had experiences at human ERs where we were saying that exact same thing. So
oh, my
the thing
Lanta.
is,
yeah. ERs are tough because when you go into an ER, you don't know. I mean, some patients or some clients come into an ER and you can be in and out of that ER relatively quickly. But when you do get into a waiting situation where you're waiting, you have to understand that I can guarantee you that these doctors and technicians are not just sitting back there, you know, eating and chit-chatting and talking and, you know, relaxing and choosing not to go into your pet, with your pet. There are ways that we assess emergencies that come in and the critical nature of them. And then based on that, we start triaging. It's called triaging. We triage them and we treat those patients accordingly down the line. And we try to give, when we go into the emergency, think about it. You're going into with a person that's obviously worried, that's concerned. It's a heightened sense of emotion. We as veterinarians are trying to give that client and that patient all of our attention that they require at that particular time. So they may have been waiting for 45 minutes and now they really want to talk to us. And now we're in that appointment with them for another 45 minutes and we're not able to see anything else while that's going on.
Right. So that's, you know, I mean, I see it all the time on every review site of every hospital. It's like, I waited. And you have no way of exactly predicting every shift, every hour, exactly what's going to happen, right? So you plan your hardest. You say, well, on average, on this day, usually we see this many, so we'll have this many doctors on and this many technicians on. And then all that has to happen is 3 more emergencies come in, or
a really severe
double,
one,
or one really severe hit by car animal that occupies that veterinarian for the entire time. So that's the thing, is like, you could come in and see no one waiting. Well, there could be 3 clients waiting in exam rooms. Mm-hmm. You could have one pet that's out back with the owner, and right before you came in, there could have been a very severe trauma or surgical patient and the doctor has to go into surgery. So that's the why. We don't want you to wait ever. But it is an ER, and we have to deal with the most sick patients first, and then go on down the line. And yes, sometimes that means you're waiting for 10 minutes. Sometimes it means you're waiting for 3 hours.
And I mean, rough. If you think about it, if you're calling up your doctor to have an appointment, they will answer the phone. They say, actually, our next available appointment is, you know, tomorrow or something. And the reason why that they're saying that is that because for that entire day, the doctor has dedicated each time for an appointment. So in an emergency, we don't have that. It's just people come in. And so you can have times or periods of times during the day where 5 things walk in literally within about 15 minutes of each other. And now you've got a massive backup because you can only work so fast through each one of those cases. And if something more sick comes in before yours, or, you know, it takes precedence. So, you know, we sort of will skip the line if your dog has an ear infection that's still significant and needs to be seen, but you have something like a hit by a car or, you know, anything more severe, awful attack wound. You're dealing with that sooner than the more stable patient.
But I definitely assure you, at every hospital, our network or out of our network, there's no one that's just sitting around doing nothing.
Yeah.
They're all working hard on something.
Yeah.
So that's the thing to keep in mind. Except for the doctor that I saw in the ER that was doing nothing. in my human ER situation. I'm just joking. Of course he was doing something.
Yeah, my human ER, same thing.
See how humans are?
Yeah.
See how I can say
so
one
jaded.
thing and then, you know, feel the other way? But
yeah.
Yes. So I think that we will wrap it up now for today. Thank you so much for joining us for this extended episode.
Yes, thank you so much. It was a lot of fun. Thank you to our sponsor, Ethos Veterinary Health. We really appreciate it. And don't forget to subscribe to our podcasts on Apple Tunes, iTunes,
Google Play,
or
wherever you get your podcasts.
And I just want to mention that you can also listen to the first 2 seasons now on iHeartRadio app.
Oh, wow. Nice. iHeartRadio.
Yep,
perfect.
Awesome.
I love that.
And give us a rating or a review.
And if you guys have any topics that you'd like us to discuss, let us know. Thanks so much. Lindsay Renzullo.
Christopher Nolikin.
See you.